treating acne is not an easy thing. At the moment, there is no universal treatment. There are some basic international protocols, principles, and methods. Unfortunately, nowadays almost everyone uses antibiotics to treat acne, oral contraceptives for acne treatment, and retinoids. Based on my own clinical practice and the experience of many leading dermatologists, I am against standardization in this matter. Why? Because there are a number of conditions that lead to acne flare-ups that cause it to progress in this way, and they require treatment. So, we first need to identify the cause. If we just use these classic, standard approaches, simply prescribing topical treatments or, again, those same hormonal medications, we might temporarily get rid of the symptoms. Yes, things might seem to improve, but it's all temporary. In other words, if we haven't found and treated the underlying cause, the acne will keep flaring up, and in any case, this approach is ineffective. Besides, after this kind of standard treatment, patients often end up with other health problems. Unfortunately, this doesn't lead to anything else. Of course, there are some basic essentials for home skincare nowadays: proper cleansing, toning, using products with acids, and definitely lightweight moisturizers, almost like fluids. All these details, once again, should be prescribed by a dermatologist. And again, only after we've found the cause of the rash. Because, as I said, it's often just a signal that you need to look for the problem inside. There are also a number of common mistakes patients make at home. For example, not only do women squeeze pimples, which is absolutely forbidden because it leads to the spread of infection, and they use various drying agents. This leads to my skin becoming very irritated. We disrupt the hydrolipid barrier, and the local skin immunity drops even further. And harmful bacteria or fungi start to multiply actively. So all these alcohol-based products and so on, tinctures, white clay, those masks you leave on for 20 minutes or more, these are not safe skincare methods. In fact, you often just make things worse. There are patients who use some over-the-counter pharmacy products that aren't professional grade. I want to emphasize that professional cosmeceuticals are different because, first of all, the ingredients are selected much more carefully. Plus, the quality is significantly higher than mass market or pharmacy cosmetics. But still, if you are buying products for yourself, choose those for sensitive skin, because drying products only cause irritation and we end up with complications. That's it. Products for sensitive skin are what you can use, and make sure to cleanse your skin morning and night. As for foundation, if you use it, Again, it's better to go for cosmeceutical brands. That is, there are foundations specifically developed for people with acne. They don't clog pores and, on the contrary, actually have caring properties. As for toning, we balance the skin's pH to 5.5 and, of course, moisturize. Moisturizing is necessary for acne-prone skin, contrary to the common belief that moisturizing creams cause flare-ups. If it's a properly chosen cream with a very light texture, on the contrary, it actually improves local immunity. Plus, there are treatments, lotions with certain acids, that help improve the course of acne. That is, they cleanse the skin thoroughly and deeply, acidify the environment, and as a result, we see very good outcomes. A diet is most often prescribed and really has a very positive effect. The first things that need to be eliminated are spicy, salty, smoked, fatty, sweet, starchy foods, and sometimes dairy. But again, it all depends on the individual. Most often, we select this diet after an individual consultation.